There's sex-specific risk factors as well as the traditional risk factors. So for women, the first thing is that age tends to be a bigger predictor than it is for men, meaning that as women get older, it's more age-related. But it doesn't have to be that only older women get heart disease, which makes it a little bit more difficult than just that factor alone. Diabetes, which is a risk factor for both men and women, but when a woman has diabetes, they have a greater risk of heart disease compared to a man who has diabetes. Even cigarette smoking, if a woman smokes the same amount as a man, the risk for heart disease is greater for a woman. So the vascular effects seem worse, and even hypertension may have a greater effect on women compared with men. But then women are very unique in the sense that they have sex-specific risk factors by being a woman. Specifically, many of them are related to pregnancy. So there's things that happen during pregnancy, like pregnancy-induced hypertension, or what we call gestational hypertension, the worst form being preeclampsia or eclampsia. Obviously, men don't get pregnant, so that's not something they experience. Even having a child early before 37 weeks of gestation, and specifically having them even earlier, 32 weeks or under, put you at a higher risk of heart disease and stroke. But then there's other diseases that are female predominant, and those are things like lupus and rheumatoid arthritis. And again, women are more likely to get them than men. We know those diseases are inflammatory states, just like heart disease, and they're more predisposed to heart disease as a result. Another great example of something that occurs much more often in women is breast cancer. And the interesting thing about breast cancer is not only do many of the risk factors are similar for breast cancer as they are for heart disease, but we're finding that women now are being cured of breast cancer, but they have a greater likelihood of going on and developing heart disease. That actually tends to be the thing that will kill them, and yet we focus so much on the breast cancer, which is important acutely, but long-term we need to communicate the risk for heart disease. And additionally, it's not just that they share risk factors, some of the genes that predispose you to breast cancer also now are being identified as risk factors or a genetic marker for heart disease. And then the chemotherapy, the radiation that people get, those also increase the risk of heart disease. So it's a really unique group. Again, breast cancer can happen in men, but it's way more common in women. And it's something that we need to start asking about and identifying as risk factors that could be present in women. And maybe we could be more aggressive if we know these risk factors exist, and be more aggressive at our preventative therapies. We're finding out a lot. We're at the infancy of really understanding women, and even as I alluded to at the beginning, some of the pathophysiology of cardiovascular disease may be different for women compared to men. We're finding a lot more microvascular disease, meaning small vessel disease. We're also finding that women are more likely to dissect in their coronary arteries. They're also more likely to get something called vasospasm that can occur. And all of that means that maybe there's a difference of how women actually present. And even the idea of microvascular disease, we still don't know enough about it, but if it is the small vessels that are affected early, we can't necessarily see that on our cardiac catheterization. But if we get better methods of identifying it, and we're using things like PET scan, cardiac MR, maybe again we'll have one day unique treatments for those states. We just don't know right now. We're at the infancy of really understanding what the differences are, and then even getting any information about how should we be treating women compared to men. What should we be looking for? Because there's a lot of different things. There's even Takotsubo's syndrome, which is also known as broken heart syndrome. Again, far more common in women than it is in men. We don't know why. Why are women more likely to develop that than men? Why are they sensitive to the things that we are seeing, identifying at putting you at risk for that? So I think we're more at the question stage than the answer stage, But I think the good thing is that we are actually now studying women. And I will say in the last 2 decades, really that's really all the data we have about women and their hearts.